Good afternoon, everyone. Thank you so much for joining us. We have a really interesting conversation for you today. A hot topic, the COVID-19 vaccine, which of course has been on everyone's lips for over a year now, even before we had a vaccine, and specifically in conversation with experts in the Medicare field. With the COVID-19 vaccine being available, there's so many different populations that need access to the vaccine. And so we're in conversation today with a few experts to hopefully clear some things up and answer some questions. So we have Bernice and Lakia on with us today. And we're really excited to learn more about COVID-19 vaccines, support when it comes to Medicare, and let's just get to it. So I would love for you both to introduce yourselves. You're gonna do a much better job than I will, I'm sure of it. So Bernice, do you want to kick us off and introduce yourself? Tell us a little bit about what you do.
Sure. Thanks for having us, Valerie. I really appreciate it. My name is Bernice Dunton, and I am an education and outreach specialist for the Delaware Senior Medicare Patrol. And what the Delaware Senior Medicare Patrol does is we empower and assist Medicare beneficiaries, their family members, their caretakers. We empower them with information so that they remain aware and alert and avoid healthcare fraud, errors, and abuse.
Amazing. Thank you so much for your service and the work that you do. So important. And I love your banner in the background. It's much cooler than my exercise bike. I need a Spur Impact banner in my house. Lakia, why don't you introduce yourself? Thank you for joining us today.
Good afternoon, everyone. My name is Lakia Turner, and I am the director of Delaware's Medicare Assistance Bureau. DMAB is a public service of the Insurance Commissioner's Office under the leadership of Trinidad Navarro, and we are funded in part by a grant through the Administration for Community Living. We are sister partners with the Senior Medicare Patrol, and our task is to offer free Medicare counseling statewide, whether it be choosing enrolling into Medicare, whether it be choosing a Medicare Part D plan. There's a lot of conversations on the television about these Medicare Advantage plans and how they work. And we actually have people who enroll in those programs who have no understanding of what they are enrolling into. They begin to get bills, they begin to go to their providers, find out maybe that they're not contracted with that insurance company. So we are here to help those individuals navigate the complexities of Medicare and make it more simplified so that, again, they can make informed decisions as to what their healthcare needs are. We also help with Medicare supplement policies and programs to help pay for prescription drugs, which I will discuss later on in the presentation.
Amazing. So I am in company with two extremely knowledgeable women when it comes to Medicare. It sounds like go-to people, it feels, in the state. You guys really know what you're doing. So in terms of the COVID-19 vaccine, it's probably the hottest topic, like I was saying, for well over a year now, right? We were in anticipation of the vaccine coming, and then we were seeing it get approved, and then it's kind of been available since January to different populations. And now we're sort of at this point where we're reaching out to people and making sure that people who want and need access to the vaccine have access to the vaccine, right? So how do your Medicare recipients or beneficiaries, how did they interact with the COVID-19 vaccine? Are they vaccinated yet? Or is there a special process that they have to go through or fill out? If somebody's receiving Medicare and they need the vaccine, what would they do?
Well, I can tell you that because the Delaware Senior Medicare Patrol is under the umbrella of the Division of Social Services, the Division of Social Services is actually, they have a team that is scheduling seniors for COVID vaccinations. the Delaware Senior Medicare Patrol is also receiving requests for vaccine scheduling, and we're sort of acting as S&P is acting as a filter, and we're simply taking vaccine requests, and then we forward it on to the Division of Social Services vaccine team. And it's been a very easy, simple process with simply sending in your name, your birth date, your address, and a contact number. And then shortly thereafter, someone from the DSS team is actually calling the Delawarean and getting them scheduled for the COVID shot.
Amazing. It sounds really simple and like there's, basic information needed, and then you can get a phone call. Where do people go to sign up? Is this on the Delaware COVID website? Is this on Health and Social Services, or is this through Medicare?
They can definitely hit the DSS website. That information is there, but you can also contact Delaware S&P. Use our 800 number. It's 800-223-9074. You call that number, let the person answering know that you would like to schedule a vaccine request. That person will then be referred to us, and then we shoot them off immediately to the scheduling team. It doesn't matter what time of day or night your request comes in. It's immediately filtered through to the vaccine scheduling team, and it happens just like that. Amazing.
That's so wonderful. And I would imagine that since we've had access to the vaccine for while now, about a month, that it's been open to all folks over the age of 16, I believe, with the different vaccines and approvals, that there's probably not too long of a waiting time to get your vaccine once you contact. Is that correct, Bernice?
You are absolutely right. That is the beauty of it. Now, I understand that there are some seniors who have been on other lists, and they've been waiting for a lengthy period of time. And I've been getting those kinds of referrals specifically because they've been waiting so long. So the Division of Social Services, they found a way to speed up the process. And it's very easy.
Excellent. It was bound to happen. There were so many of us that wanted to be vaccinated all on the same day that it was bound to happen at some point. But I'm glad to know that we've kind of smoothed things out. And I know the state's been working so hard to vaccinate as many people as possible. It's no easy feat, right, to make this happen with so much anticipation. Shout out to the state and to all the Walgreens and different pharmacies, offering. That's where I got my vaccine. I know this may be a surprise, but I'm not elderly, so I did have to wait for a little bit for mine, but I was eligible to go to Walgreens to get my vaccine. It was quick, painless, and it sounds like it's even easy to schedule it these days too. So, Lakia, why don't you talk to us a little bit about the support that is available for people in terms of Medicare?
So we realize that it's a national pandemic, and individuals are having to choose how to pay for their health care. They need program, they need assistance. We found that a lot of individuals who were on Medicare have since retired because of when COVID-19 hit. They were unsure. Some of the businesses closed. Some of the individuals, felt there was a need for them to retire due to the pandemic and not being aware of what may take place. So we received a lot of calls since last year about programs to help pay for their Medicare costs. We have a few programs that I'll talk about this afternoon. One program is called the Medicare Savings Program. There's 3 programs under this: the Qualified Medicare Beneficiary Program, the Specified Low Medicare Beneficiary Program, and the Qualifying Individual 1 program. So if an individual qualifies for the QMB, which is a Qualified Medicare Beneficiary, they will get help with paying their Medicare premiums for Part A and B. They will get help with paying for the deductibles which is $203 in 2021. And in addition to that, they will get help with paying the 20% that Medicare does not cover. The SLMB and the QI1 program, they help pay the monthly Medicare Part B premium only, which in 2021 is $148.50. So that is money that they could put back into their account. Now, if someone qualifies for any of these programs, they automatically qualify for extra help through the Social Security Administration to help pay for their drug costs. Individuals with the lowest income will pay no premiums, and they'll pay a small copay at the pharmacy. However, individuals with a slightly higher income, they will pay those programs will help pay towards the deductible, and they will have a small copay when they go to the pharmacy. In both of those programs, we actually do the applications here at our office. So we have staff on our hotline who is available Monday through Friday from 8 a.m. to 4:30 p.m. to process those applications. There is also the Delaware Prescription Assistance Program that came about from a pharmacy, a tobacco settlement years ago. And with that program, they also help with the Medicare Part D costs. It's a $3,000 benefit that an individual can use towards their Medicare Part D. That Delaware Prescription Assistance Program will pay 100% of their premium. They pay 75% of the deductible, and the individual pays $5 or 25% when they go to the pharmacy. So it's a huge savings. It's up to $5,000 a year that some of these programs will be beneficial for. So again, here at our office, we process those applications. They take about 5 to 10 minutes. You just need your name, your address, and your income information. We do know that we always educate individuals because there's no local Medicare offices. No one from Medicare will ever call you and ask you for your Medicare number or your Social Security number. However, with those state and federal applications, it is required that they provide their Social Security number and their Medicare number. So just so they know that we won't call them and ask for that information, but when they call our office, they should be prepared to provide that information along with their income benefits.
Such a great reminder. Spam calls are happening all the time, and it can just be so tricky, especially when you are hearing something about health insurance because it's so critical. You never know when something could go wrong. So what a great reminder that you all won't reach out and say, hey, give me your personal information over the phone, but to be prepared with that information, go grab it from your firebox, right, in the safe spot in your home.
Exactly.
When it's time to fill out the application.
Exactly. And you'd be surprised. I'm sure Bernice can attest to this. We get Medicare beneficiaries every day who will say, somebody called my office. They asked for my personal information. I gave it out. What do I do now? And, that's when they reach out to the Senior Medicare Patrol so that they can assist them in those situations. But when we do education out in the community, we always inform individuals, do not give out your personal information. Medicare does not call your home asking for that information.
Absolutely. And during that outreach and education, we try and remind everyone that Medicare card, that Medicare number should be treated like your most prized possession, treated like your credit card, and never share the information with an unknown source. If someone does call you on the phone and perhaps it sounds legitimate, but there's something in your belly telling you that maybe I should be asking a question, there's nothing wrong with someone hanging up and calling the number back. You flip the switch, you flip the table, and it's okay for you to hang up, or it's okay for you to call back and do some investigation of your own.
Yes, I usually wait for it to go to voicemail. And if they leave a voicemail, I say, okay, I'll take a listen and call them back. I have been guilty of having my voicemail box full. So just a reminder to clear that out.
with the car warranties, that's the messages.
Yes.
Exactly.
And
go ahead.
While we're having this conversation, we do want to make Medicare beneficiaries aware that Medicare does cover the COVID-19 vaccine. So it is no cost to you. So make sure they are going to ask you your insurance information. It's okay to provide that information, but you should not be charged for any of the services, whether it be for the reading of that COVID for the reading if you have a test done, or if you have a vaccine. There's no balance billing or anything. There's no cost to the individual.
Absolutely.
That's amazing. So the applications that you talked about, Lakia, where can folks access those applications?
So they can call our local office. Again, there's counselors here to answer those questions. The telephone number is 302-674-7364. And again, we offer counseling through telephone, through WebEx, through Duo if you're an Android user. If you're an Apple user, we have FaceTime. So there's multiple ways that you can contact our office so that we can help you with the application assistance. We realize that there's a lot of individuals in the community who, first of all, don't even know probably that DMAB or SMP exists. Because a lot of times we get calls and be like, I've never heard of your organization. We've been trying to do a lot of marketing and outreach through television to reach those who are homebound, who are in rural areas, for caregivers and other professionals who may not know. But every state has a program similar to DMAB, which it's going to be called something different in another state. But every state has a DMAB and has an SMP program.
So good to know. So if folks have family members in other states who are in need of resources, help, COVID vaccine information, folks, over our neighboring areas or even across the nation can look into their own Medicare Patrol programs and Medicare support programs.
Yes, ma'am. They're called so DMAB is on the federal side is called the State Health Insurance Assistance Program. So we're the SHIP program. So if an individual calls 1-800-Medicare, they are going to refer them to the local SHIP office, and we are the local SHIP office. But again, we go by the name DMAB.
A little bit more catchy. And why not put Delaware in the name, right?
Exactly.
That's fantastic. So in terms of the resources available, the education and the outreach, I'm sort of getting the sense that if you are receiving Medicare benefits, if you have your health insurance sort of through Medicare, you're enrolled in everything, there could be more benefits that you could be taking advantage of. You just may need to do some education. Is that correct?
Definitely. Again, when an individual calls 1-800-Medicare, more than likely they are going to refer them to the local state office so that they can have someone, a grassroots organization that can help them out. And again, we're federally funded by these organizations. So while they do a lot of outreach on the federal national side, we also do a lot of outreach on the local side. So you may see a commercial running in your community about the programs that are offered under the Medicare Improvement for Patients and Providers Act. And that's what those programs that I discuss, it's called MIPA. And we are funded to find these individuals who qualify for help, who are currently not receiving the benefits that they may be eligible for.
Amazing. Thank you all so much for the work that you're doing with this. It's so important. And I know that we've shifted from here's where you can go get the COVID-19 vaccine to let us do some outreach in your community and let you know more information about the COVID-19 vaccine. The state has been doing so much work to learn about the apprehension people may have or hesitation, access issues, right? We were talking about this last October, November in terms of the election, right? Transportation to get there, absentee ballots, right? Sort of the same conversation with the vaccine here. The good news is there is no deadline when it comes to the COVID-19 vaccine, whereas Election Day sort of had a deadline. So I'd love to know from both of you just your take on the importance of getting vaccinated. We're sort of reaching this point where some people may feel hesitant to get the vaccine just because it has only been approved for emergency use or what have you. So from your perspective, the folks that you talk to and the work that you do, why is it important for folks to get vaccinated?
That's a great question, Valerie. I'm just going to speak personally because I have myself and my family, we're all scheduled to get our first dose tomorrow, as a matter of fact. And we went through the Division of Social Services scheduling unit to do it. So I have my two teenagers who are high schoolers. Even though they have been working remotely, they still have some activity, band, that kind of thing, where they actually go on site to the school. I just think that it is important for all of us to think about the benefits of this vaccine, because the bottom line is that this keeps us healthy. This keeps all of us healthy. And we all know the horrible opposite of this spectrum. I mean, we've lost so many lives to it already, and we're still losing lives to it, as a matter of fact. So this is just simply about being safe, being smart, and getting COVID-19 under control, so that all of us could get back to some semblance of a natural existence. That's the way I see it. I want to be safe because I work in a field where my job, I am in close communication with people all over Delaware. I want my children to be safe because eventually they're going to have to go back to school. I just think that it is the best thing that all of us could do for one another.
Amazing. Thank you, Bernice. That's such a good message. I couldn't agree more. Lakia?
Exactly. I same sentiments as Bernice. It's not going away. It's not going away. And we serve a very vulnerable population. We serve those who are over 65. We serve those who have underlying health conditions. And we realize that we want to keep those individuals healthy. So in order for us to keep them healthy, the best way is to make sure that we're vaccinated and make sure that we're washing hands, to make sure that we're staying socially distanced from each other, so that we can serve the community, make sure that we're getting the information out to them. Because as we know, the state pretty much shut down last year and we were unable to actually go out into the community. So as long as we're unable to go out to the community to serve these individuals, they do not know about these services. So we want to make sure that they receive the education that they need. So it's important to keep your family safe, to keep your loved ones safe, and to keep the community safe.
Mm-hmm.
Yes, it feels like the thing to do to be a good steward of our community, right? There's a lot of different conversations we've had on Facebook Live with Spur Impact as the host. Topics like environmentalism and recycling, right? Like that's great to do as a community member. Voting, great option to do as a community member. And now COVID-19 vaccine, how to contribute to your community and be a good steward is getting vaccinated and also encouraging others to get vaccinated as well. I really appreciate both of you being in leadership positions, speaking to the importance of this topic and the benefits and everything. I'd love at this point to open it up if you have any closing thoughts or anything else you feel important that you want to share.
I'd like to share that Delaware Senior Medicare Patrol, as well as Lakia's program, we offer volunteer opportunities also. Our volunteers are a huge part of the S&P mission. They play a vital role in dispersing this mission. And our mission is always to educate and empower Medicare beneficiaries, their family members, their caretakers, equip them with tools so that they can avoid Medicare fraud, because Medicare fraud is real to the tune of billions. It's costing us billions, and that's only what they've been able to capture. So the need for volunteers is always present and available here for Delaware S&P. Our volunteers cover all counties in Delaware, so we welcome anyone who wishes or who has the spirit of community service. We welcome anyone interested, and all they'd have to do is, again, contact us via our 800 number 1-800-223-9074.
And most of our volunteers are cross-trained. So while they work with SMP, they also work with DMAB. So generally, sometimes we do have joint training sessions so that we can educate individuals on both parts of the program. So definitely, we're always looking for volunteers to help us get the word out. It could be going out to a senior center, dropping off information. It could be presenting at an event. It could be stuffing information in one of the offices so that we can take the information out into the community.
Yes.
Incredible. I had no idea that you all worked with volunteers. So what another great way to contribute if you decided to take early retirement, which my dad was this close to being eligible to doing from Chase, this close, early retirement, or if you just have more time on your hands than you were expecting from a change in employment, what a great way to, after you've been vaccinated, give back to the community and help others get vaccinated as well. Because it's going to take a lot of people to make this happen, right? A lot of collaboration, a lot of outreach to get our communities back to safe. The before times, as Bernice was alluding to earlier, our sense of normalcy. So thank you both so much for your time this afternoon. It was so wonderful learning from both of you. And we hope that everyone watching takes advantage of these programs, gets involved, and most importantly, gets vaccinated.
Absolutely.
Thank you so much, Valerie.
Thank you.
Thanks, Bernice, for the invitation.
Take care, everyone.
Bye-bye.